noticed a lot in several locations in and around Shillong city alone, or maybe Nongstoin as a headquarter, or any other headquarter for that matter. So today we are sitting here and my officers will attempt to reply to some of the important concerns that you have, say for example on rabies. So please ask your questions. We are here to respond to the questions on rabies.
You can tell us about the recent case and then let us know what went wrong.
Can you come here?
Yes. So good afternoon. I'm Dr. Valerie Lalu. I'm the State Surveillance Officer in charge of IDSP. So yes, and Nodal Officer for Rabies is Dr. Yada. She's sitting there. So we are both we are into surveillance of various diseases, and rabies is one of them. So regarding rabies, first of all, I would like to say that we've had a lot of cases of dog bites, and 96% of rabies is because of dog bites. And out of these, we've had till the last case that was reported, that was the 16th death that happened this year. So this incident is also very unfortunate because being a health professional herself, our MLHP, who's a nurse, she succumbed to this disease, which is actually 100% preventable and at the same time 100% fatal. So with vaccination and wound management at the right time, this disease could be prevented. But unfortunately, because of reasons unknown to us, the MLHP could not get the congrestifol. She could not get the vaccine at the right time. And as I mentioned, rabies is a fatal disease. So once the signs and symptoms were, they started to be shown in her, there was no chance of, of getting back to normal. It was a progression towards fatality. So I think that is what we can say about this.
Was
case.
it due to lack of
just 1 2 3 points I
awareness?
mentioned about this matter. Just 2 3 points about this case. Number one, the person was bit by a small puppy. So people generally take puppy bites as something very casual, and we should not take it like that. And vaccines for rabies are available at all the PHC level across the state. So please, anyone through the media, the request is that awareness that don't take any bites very seriously, and for those dog owners, please do that their pets are also taken care of. That is also very important. And this is the week which we are commemorating the Rabies Control Week program. Tomorrow, Madam and our Honorable Veterinary Minister also will be there, along with the Veterinary program. The entire week it's going on across all the state. Tomorrow is the last day of the program. So do not take any bites very casual. Immediate attention has to be given. Immediate approach after the health facility, and the rabies vaccines are also there, and medical officers are also been trained on this matter. So their consultation should be taken.
So these rabies deaths, is it a case of lack of awareness?
Probably lack of awareness, and at the same time complacency. As sir had also mentioned, it was a bite due to a puppy. So usually we think that puppies are still sterile, they don't have any much diseases in them, we find them cute and harmless. But actually puppies, less than 2 months, they are not vaccinated. So these are at the stage where if there is any infection in them, they are most probably that they will infect another person who's bitten.
How many cases of rabies, such type of incident happen in the last 5 years?
Last 5 years,
1 year.
yes, we have. What happened is that rabies has been it's a notifiable disease since last year. Okay, and but 2023 March. So before that, there was not much of a system of reporting and of documenting cases. But from 2023 onwards, we've had
2023 onwards,
Yes.
how many cases of rabies found in the state?
yes. Deaths were around, I think, 9 deaths that 9 to 11 deaths that happened in last year, 2023. So that was high. I think it was 11, not to be mistaken, and that was for the whole calendar year. This time it's only in the month of till September. We haven't, it's not complete yet. So we still have actually 17, but the 17th case we have not completed our investigation yet. So officially it is 16 cases of death cases.
So all
we-
cases
we
are
did 11
related to.
and 16 this year.
Yes.
27 cases in total,
Total
since
from
last
2 years.
2 years.
So all cases are related to stray dogs, or If you can
Most
tell.
of the cases were stray dogs. Only 1 or 2 were their own pet dogs, but majority were stray dogs. And also
Rural
because of, yes, and most majority of them were in rural areas, and also the majority of them did not receive any vaccination. So the post-exposure prophylaxis was not given to those, they had not taken after the bite.
so there was a report by the Shillong Municipal Board. I don't remember correctly, but I think it was last year. They reported like over 9,000 people to where there was dog bite cases.
Number of dog
Yeah.
bites have
Yes.
come from rabies
Yeah.
deaths.
Yeah.
So dog bites are
So
coming.
is Health Department coordinating with the Shillong Municipal Board to ensure that these stray dogs are at least given that anti-rabies vaccine?
So we are currently having a very good coordination, not only with municipal corporation, but also with veterinary department. We are, if you can come, you are all invited tomorrow.
Use also
for
come
the-
on
yes.
11 o'clock.
Tomorrow, 11 o'clock, we're having this function. It is in collaboration with the veterinary department and also municipal corporation. We're having a program tomorrow. What we've been municipal, in fact, they have dog catchers, and one dog catcher who has been doing all this. They've been catching stray dogs, and the veterinary department has been conducting these mass vaccination campaigns all across the state. So even now, it is happening across the state. Yesterday, it happened in Southwest Khasi Hills and East Khasi Hills.
So far, how
So-
many dogs have been vaccinated?
So the report we have for this year itself, from East Khasi Hills alone, 600 stray dogs have been vaccinated so far.
Do we have a proper, kind of a survey to, regarding
number of
the
stray dogs.
population of stray dogs?
That is the veterinary department.
We have to do
They
that,
have to
but
do-
last time we had
But
a
do they share these statistics with the health department?
Let me answer that.
Yes.
Yes, we have a joint steering committee headed by the chief secretary
Yes.
with all these stakeholders. We've already had a meeting on this 1 month back. Same hall we had a meeting. As a culmination of that, only this week is also being commemorated. Now the sharing of information, etc. also has started.
Well, sir, in fact, last time I complained about stray dogs to municipality, and I was told that because of some court case and all this, they are actually not going for all this vaccination, and even they are not taking away the stray dogs, which are actually becomes perishes. So from the health department side, because in view of this rising cases of rabies and so many 27 deaths in just 1 year, so
2 years.
2 years.
2 years.
16 now, 11 last year, 16 this year.
Up to now,
Yes.
16.
Okay, so 27 deaths in 2 years. So
It's an alarming number.
any special instruction given to municipality, or are you taking up with the municipality so that this can be checked?
That is why we have this rabies week, anti-rabies week. We want to firstly set the ball rolling on the sterilization and vaccination of stray dogs, which is undertaken by the Department of Veterinary. So tomorrow there is this culmination of this week-long awareness program, where both the Minister of Veterinary and the Minister of Health will be together at the same platform to receive information on plans that are being proposed to curb this rampant spread of rabies. Like the doctor has just said, it is fatal, it is a serious concern. 27 deaths up to September 2024 is a number which is very alarming. We will meet tomorrow and we will take this forward and we will give you more information in the program tomorrow.
Why did the department wait for deaths to take place to react? Why did you do to create awareness so that these deaths could have been prevented?
I wish that it was as simple as you say it is. Unfortunately, awareness on rabies, we now realize has become a big priority. And hence, before the situation deteriorates, we are already planning an approach. And this approach is what we hope will happen henceforth. So it is very tricky because, as correctly pointed out by one of your own scribes, there are also protectors of stray dogs. Until all concerned stakeholders come on the same platform, it is going to be next to impossible to handle this. We hope that after this rabies awareness week, we will be able to strategically attend to this big problem. And it is also not true that we are waiting for deaths to increase. A rabies vaccination is the responsibility of a citizen. There is also a talk that rabies vaccination are not available, etc., etc., etc. Hence, now we are committing to the state that we will ensure that up to the PHC level, there should be rabies vaccination available so that citizens can avail this facility to prevent that. We are hoping that this will happen soon, and we are curbing it, and we hope that we will be able to address it.
Which district has
West Jaintia Hills and West Khasi Hills both have six deaths. Two
Hi.
deaths.
West Khasi?
West Khasi and West Jaintia.